Well, have you or anyone in your family suffered from colorectal cancer? March is Colon Cancer Awareness Month. Let this be your reminder to schedule your colonoscopy. I've had about that many, 6, I think, to this date. It's important to know, right? KSLA's Tamer Knight reports on the importance of colorectal cancer awareness and prevention.
According to Louisiana Cancer Prevention and Control Programs, Louisiana has the 4th highest colorectal cancer death rate in the United States. They say it's due to Louisiana being a high-risk population and lack of screenings. How do you know if you need to be screened for a colonoscopy?
Everyone should really pay attention to their bodies. If you start noticing changes such as change in stool size, caliber, meaning the diameter of it, blood in your stool, or if you start having abdominal pain, weight loss, or other things that just seem a little off, please see your doctor because you may need to get a colonoscopy sooner than age 45.
Colon cancer may not be the only reason to get a colonoscopy. In fact, there are other health factors that could lead to potentially getting the procedure sooner than age 45.
I was only 21 years old when I got my first colonoscopy, but my primary care doctor recommended it because I had extreme bowel issues and irritable bowel syndrome for a long time. So they recommended that I get a colonoscopy done.
And maybe, like many of you, Willis says she was uncertain about the procedure and the process.
As anyone can imagine, any kind of prep for a medical procedure is no fun, but I think that the doctors and my nurses with gastrointestinal specialists made it really comfortable for me because they picked the easiest prep option for me.
The prep includes not eating for 24 hours, but once the procedure is done, the recovery time is little to none.
I think my biggest issue with the colonoscopy was getting my eating habits back to normal after not eating for an entire day. I just had to get my stomach back to not feeling so queasy, but other than that, like, my recovery was fine. I was back to doing normal things the next day.
Colon cancer is highly preventable if treated early and properly.
So for the patients out there watching this, if you have family history, then you probably need to be screened earlier, especially if they're young when they were ever diagnosed. The other people that need to be careful are people who have conditions such as inflammatory bowel disease, that's Crohn's and ulcerative colitis. You need to be screened earlier because you have a higher propensity of developing colon cancer.
If you're the recommended age, have a family history of colon cancer, or have a bowel issue, you can schedule your colonoscopy appointment with gastrointestinal specialists in the patient portal or speak with a nurse at www.gis.md. In Shreveport, Tamer Knight, KSLA News 12.